Hey guys, I'm Combat Craig, and today we're going to be talking about some compensation and pension exam do's and don'ts. Let's just hop right into them, and we'll start with the don'ts. Don't say you're having a great day. Think about it. You're at a compensation and pension exam. If you proved your claim up enough, you wouldn't even need to be at a compensation and pension exam. The rater would be able to just give you the rating and the compensation you deserve. So I'm not saying that the reason that you're there, the doctor's, against you or anything, but he's certainly not there to help you. He's there to record whatever the VA hired him to record. So if he asks you, "How's your day going?" do not say, "Gee, I'm having a great day." How's that possible? How could you be having a great day? You're at a compensation and pension exam. I could think about a lot of things I'd much rather be doing, like getting kicked in the nuts instead of being at a compensation and pension exam. It's just common, it's courteous. He's saying something, and you would say this to normal people. Hey, how's your day? You don't want to come off as drama or whatever. Say, oh yeah, it's fine or whatever. Like that's good and normal in everyday life. In a CNP exam, it's all getting written down. So when this is looked at, all they see is the words. So how I asked the veteran how he was doing. Veteran said, "Had great day." So don't want to pound this one too much. Do not say you're having a great day unless you're having a great day. And if you're having a great day, what the hell are you filing a disability for? You're miserable. You have a disability and you're undercompensated. So don't offer information that you're not asked about. This isn't a bullshit session. He's going to go in and ask you some questions and you're going to answer them. You don't need to elaborate. You just need to politely answer the questions. Can you get up and walk? If you hobble, you hobble, use a cane, whatever. Do that. Do not walk and then do some sit ups and do some jumping jacks. Just walk. Just do what he asks you to do. If he asks you any kind of question, keep them short and simple. Again, these things are going down on paper. The more you're blabbering on, it's not good for you. I don't know. The closest thing I can think about is being in court. Never been in court, but your words can and will be used against you. Another thing that I would say don't do is don't be rude. I know this is a little hard to do. Don't give too much information. Don't tell them you're having a good day. You don't need to be rude by saying that stuff. I mean, how are you doing today? I'm not doing well. My day's horrible like the rest of the days, right? You don't need to worry about hurting this guy's feelings. You're never going to see him again. But don't be rude. You're there to do a job, which is to be a veteran, to be evaluated, right? And then he's there to do his job, to be the doctor, to evaluate you. Don't make his job any harder than it needs to be, and don't get adversarial with him. It's not going to help. Just be polite, answer his questions, short, to the point. You don't know how long the time limit is. You don't know how fast he's going to rush you through there. So don't bullshit around and talk about what's going on Facebook or the world in politics. So those are a couple don'ts. Let's talk about a couple do's. Do tell the truth. It's always easier to tell the truth anyway, because that's it as you remember it. Now let's add a little complication, right? Now you're going to be nervous. You're going in for a PTSD claim, maybe military sexual trauma that happened a long time ago. You really haven't talked about this at all, and very little, if that. It's going to be hard enough for you to go through and talk through some of this stuff. So tell the truth. You don't need to elaborate. You don't need to make add any spice to the story. That's just going to come off disingenuous and possibly even like a liar. So just stick to the truth. It's always easier to tell the truth. You can't remember or you need to refer to notes or something like that, totally fine. Stick with the truth. Another thing you should do your research before you go to your exam. Research your DBQ. Hopefully you went and got a DBQ filled out to show your side of the story, because that's what he's going to be doing, is filling out a DBQ, writing the VA side of the story. It's not always an adversarial thing. But like I said, you wouldn't be at a CNP exam if you proved up your claim enough because you had enough medical evidence. So you're there for more info so the rater can rate you. So review your DBQ, have an idea of what kind of questions he's going to be asking you. If you're in there for migraines, these are the terms that I should be looking for. These are the kind of questions that he's probably going to ask. Having some kind of general idea of what you're in there to talk about will help you stay on track. Um, do pay attention to what he or she is doing. Is he like using, if you're in there for an orthopedic exam, is he using a goniometer on you? It's a little plastic protractor thing. If you're in a orthopedic exam, in almost all cases, they're measuring pain on movement, and range of motion. So if they are just eyeballing your range of motion, how are they able to tell? Yeah, whatever. They've been doing it for 35 years. Their eyes are not calibrated to document the difference between 12 and 13 degrees. I mean, that could be a 10% rating increase. And they're also supposed to be recording the pain and how much pain you're in. So make sure that you do not uh, let him move you into the pain. Go a little farther, push through it, soldier. Yeah, you don't want to do any of that stuff. So, couple do's, couple don'ts. Combat Craig out.